The University of Benin Teaching Hospital UBTH has denied a recent video circulating on social media alleging that the hospital lacks beds for diphtheria patients, forcing them to lay on the floor. A public health physician and chairman Infection Prevention and Control Committee and head of surveillance team at UBTH, Dr. Esohe Oliver, debunked the claim during an exclusive interview with BTV News, noting that the hospital has the capacity to accommodate all patients regardless of their ailments. The report.
A recent video circulating on social media alleging that the University of Benin Teaching Hospital UBTH currently lacks bed to accommodate diphtheria patients prompted the news crew to visit the hospital to confirm the allegation. In an exclusive interview with a public health physician and chairman of Infection Prevention and Control Committee, Dr. Esohe Oliver denied the allegations, stating that the hospital has the capacity to accommodate all patients regardless of their ailments and has never rejected any patients. Dr. Esohe Oliver also clarified that diphtheria is a seasonal bacterial disease that mainly affects children between the age of 0 to 15 years, adding that while Edo State is not the only affected state, other states in Nigeria like Kano and Katsina have recorded highest cases, noting that Edo State has had relatively few, with UBTH recording only 18 patients since the outbreak began.
Which as a federal institution, we do reject patients, even though our facilities fail, we do reject patients. There are sometimes, largely because some of the state facilities are not working as optimally as so we are seeing more patients, and it's not just because of this season. We have been seeing an upsurge in the number of patients, probably because of the services we provide and the patient satisfaction that patients receive here. So there's no time that we have rejected patients. Our doors are not closed at any time. As a federal institution, with the scope and capacity that we boast of, we treat all patients and we receive all patients in our emergency room. First myth out there is that it's a viral disease. Diphtheria is not a viral disease; it's a bacterial disease, and it is vaccine preventable. It affects mainly children, and so far, what we have been seeing so far in UBTH, we have had 18 cases of diphtheria. 4 are presently in our children emergency receiving care, and we've had good outcomes except for 3 that came very late with severe complications. Now, diphtheria on its own is not the big issue. It's that it produces toxins that now causes complications in the heart and other parts of the body.
Dr. Esohe also noted that diphtheria is an airborne disease with symptoms like cough, sore throat, fever, weakness, and tiredness, noting that it is a transmittable disease. She said the bacteria can spread rapidly in crowded environments where sanitation and vaccination are inadequate and hygiene practices are poor. She advised residents to seek medical attention promptly if symptoms are noticed, warning that prolonged cases can lead to death, adding that diphtheria can be prevented through vaccination, avoiding overcrowded environments, and maintaining good hygiene.
Are usually sore throat, fever, there are swollen glands in the neck, we call them, and it is commonly called the bull's neck. And then there's a pseudomembranous film. If they open their mouth, you see a grayish white film, in the throat. And then weakness and tiredness. Usually, once you see these symptoms, and they usually come within 2 to 5 days. Once you see these symptoms in a child, even though the immunization status of the child is full, please bring that child to the nearest health facility to emphasize the role of hand hygiene, of sanitation, and more importantly, the role of early detection and bringing your child, your ward, to the healthcare facility, because before the toxins start to be produced, if you come early, you are treated.
Dr. Esoe also stated that through the hospital collaboration with the Edo State government and the Nigeria Center for Disease Control and Prevention (NCDC), there have been sufficient drugs and other equipment to accommodate patients. Osarogie Agwebo reporting for BTV News.